Scientists are working overtime to understand Sri Lanka's third COVID wave, with 3,500 infections a day and dozens of deaths. This is the country's only lab at the University of Sri Jayasinghhe in Colombo carrying out genome sequencing on samples from patients. The process helps identify how the virus works, what strain it belongs to, and if and how it's changing. The strain first identified in the UK has spread rapidly in Sri Lanka. Scientists are now looking at another strain first found in India.
We are doing sequencing to see whether the Indian variant is coming, because again the Indian variant is shown to be even more transmissible than the UK variant and could also be causing severe disease. So to plan out the health strategy, the control strategy, the hospital resources, the healthcare management, or to do all that, sequencing is important.
With the latest surge in cases, the need for sequencing is more urgent than ever, but the lack of materials is delaying vital research.
There's a global shortage of certain sequencing reagents. So there's a huge delay in us getting the reagents, either because there is a shortage or we can't place orders soon enough because of these lack of funds.
As Malavige's team races against time, senior doctors have called for an immediate 14-day lockdown of the country. They say short-term restrictions imposed at the moment aren't working.
As you give the break, people come out and people go for work and then they gather together and then we induce spread of the infection again. So that's why we need to have a lockdown at a stretch without having interruptions in between.
The country is also struggling to vaccinate its population of 22 million people. Only approximately 1% have been fully vaccinated so far. The government is facing criticism for mismanaging the vaccine drive, leading to scenes like this, where anger and frustration spilled over. They say they are trying hard to use the doses they have effectively to counter the current spike in cases.
We are prioritizing the high-risk groups, we are prioritizing the health workers, and we are prioritizing the other state persons who are repeatedly involving in the COVID patients. So that's the way we are trying to control this hyper-epidemic situation of COVID here.
The government says it's trying to get more vaccines, not just for the first doses like those being given here in Kalutara, but also for the second round of shots, which are now overdue. The recent surge in deaths and infections are adding to the urgency.
Experts warn, though, that vaccines will take time to make a difference. The only solution at the moment is to stop the spread of the virus. Minelle Fernandez, Al Jazeera, Kalutara, Sri Lanka.